Welcome to our Newlife IVF Medication video series. My name is Ruby and I'll be showing you how to administer Menopur. Menopur is given to support follicle growth, which is prescribed by your fertility specialist. Menopur is generally given once per day as advised by your fertility nurse. Before we begin, let's prepare. You'll need your Menopur vial or vials, depending on dose, needle, water syringes that come in the box, administering syringes, and a sharps container. This is a 1200 unit set and will contain 2 water syringes. You may be given a 600 unit set, which will only contain 1 water syringe to mix with the powder vial. Today, we'll be preparing a 1200 unit set. Wash your hands with warm soapy water and dry thoroughly. Start by removing the cap from the Menopur powder vial. Next, remove the end of the orange needle by twisting off the end. Remove the rubber cap from the water syringe and replace it with the needle by pushing it on until firm. Then remove the needle cap. Place the syringe with the needle attached into the Menopur powder vial. This must go directly in the middle of the rubber section. Push the plunger down to release all the water into the vial. This powder will instantly dissolve once it meets the water. Twist off the syringe from the needle, leaving the needle still in the vial. Remove the rubber cap from the second water syringe and attach it to the needle. Now, push the plunger down to push the second water into the vial. If you do notice any undissolved specks of powder, you can gently swirl your solution until they completely dissolve. Do not shake. Remove the syringe and needle from the Menopur vial. You can now discard the empty water syringes and needle into your sharps container. Take the single-use syringe from the white box. This syringe is used to draw up and administer your Menopur dose. You will see the doses on the side of the syringe. Remove the cap from the end of the syringe and place your needle into your vial. Hold the syringe with the vial in the air and pull down the plunger to your prescribed dose, then remove from the vial. If you do notice any air bubbles, you can flick the syringe and push up the plunger so that they are released into the air. This injection is given below the navel line. It should be injected at least a couple of centimetres away from the navel. Make sure you rotate your injection site with each injection to avoid irritation. Now, pinch your belly using your thumb and index finger. Hold your syringe at a 90-degree angle and insert the needle into your skin. Push the end of the syringe until the dose has been delivered. Release your pinch and remove the needle from your skin. You've now finished injecting your Menopur. Discard the used syringe. Depending on your dose, the vial may contain a few doses and it can be placed back in the fridge ready for your next use. When empty, place the vial into your sharps container. Thank you for watching. If you have any questions, please contact our nursing team on 03 80 80 8939.